The two most commonly asked questions regarding the US healthcare system is why doesn't the United States have universal healthcare? And why do most Americans get their health insurance through their employer? Canada and the United Kingdom, two countries who are commonly used as a comparison, were both able to establish universal healthcare after World War II. Canada's system, called Medicare, can trace its roots to the 1960s in Saskatchewan, and the United Kingdom's National Health Service was formed in 1948. And if both of these industrialized nations could develop universal healthcare, why didn't the United States adopt such a system? Well, this is a result of an unintended consequence of a 1942 tax break to finance World War II. And this tax break created loopholes in the law and the system, and is still the main reason why over 50% of Americans get their health insurance through their employer. So in this video, I'm going to discuss the reasons why most of these Americans get their health insurance through their employer, and why this is a benefit many of them do not want to give up for a national health insurance system. So guys, stay tuned and I'll dive right in. The debate and discussion about the cost and how to fund the US healthcare system has been ongoing since the 1920s, when rising costs of physician services and hospital care became a major concern. At a national economic conference in Washington, D.C. in 1925, the Committee on the Cost of Medical Care was established by physicians and many foundations to examine and make recommendations into the rising costs of healthcare. And this committee found that healthcare spending was 4% of our GDP, and that physician services were the highest at 29.8 cents for every dollar. The most quoted statement in the committee's report was the problem with our healthcare was not the system, but the lack of a system. So the committee recommended a national health insurance, either through voluntary or compulsory means via taxation. But within the CCMC, there was great opposition, and there was also a fear of government running and taking over healthcare. And these are the same discussions and debates we're still having close to 100 years after the committee's report. But by the late 1920s, the country was in the midst of the Great Depression, and any comprehensive healthcare reform was going to take a back seat. But by the early 1930s, President Franklin Roosevelt and his administration looked into a comprehensive national health insurance plan, but there was opposition by the powerful American Medical Association and other powerful lobbying groups, and Roosevelt feared that if he pressed on with the healthcare reform plan, that his entire Social Security bill would fail to pass. And as these debates were ongoing in Washington, D.C., most Americans were continuing to pay for medical expenses out of pocket. In the early 1930s, two insurance companies were formed, Blue Cross and Blue Shield, which guaranteed service for a fixed fee. How they worked was you would pay a premium and all of your healthcare costs would be covered. But the plan that really picked up momentum after this time period was the employer-based health insurance. See, during the height of World War II, millions of workers left the labor force to join the military, thus creating a labor shortage. To prevent inflationary pressures and economic downturn, Congress passed the Stabilization Act of 1942, which allowed the president to freeze wages and salaries for all workers. As a result, since companies could not offer higher salaries to attract or retain workers, they began to offer health insurance plans as part of the overall compensation package to their employees. There was also an exemption in the law that said that insurance and pension benefits could increase during this freeze, thus causing more employers and companies to offer insurance. In order to continue to finance World War II, Congress passed the Revenue Act of 1942, which increased corporate tax rates and set an excess profit tax of 90% on corporate revenue greater than pre-war levels. As a result, many companies started to look for loopholes in the system to lessen the burden of the new tax laws. As a concession to labor groups, the government exempted employer-based health benefits from tax and wage controls, and this in turn increased the demand for employer-based health insurance. Since employee benefits such as health insurance were tax deductions for these companies, many companies chose to pay these employee benefits rather than pay a tax to Uncle Sam. And the benefits to the employees was that they did not have to pay any tax on these benefits such as healthcare insurance. Although after World War II there were many attempts at reversing these laws, there were a series of legal administrative rulings that kept these laws in place, and that by the mid-1960s, over 80% of Americans had some sort of health coverage, mostly through their employer. But since the 1990s, the employer-based health insurance market started to unravel. And this is because as healthcare costs started to increase, the insurance companies started to increase their premiums. And for many small companies, they just couldn't afford these premiums, so they either stopped offering health insurance for their employees, or they redesigned the plans to increase the cost sharing by the employees. But what ended up happening was many healthy employees declined the employer insurance, thus keeping only the sicker employees in the plan, and the insurance companies increased the premiums even higher. And this was called the death spiral of the employer-based health insurance. According to the Kaiser Family Foundation, the cost to cover a single employee rose from $2,196 in 1999 to $5,884 in 2013. But by the early 2000s, there was also a rise in the individual health insurance market, which meant that people could go buy insurance for themselves and their families. But the problem with the individual health insurance market was medical underwriting, which meant that if you had any pre-existing conditions, this would be a reason for an application denied, and that there was no standardization of any of these plans in these markets. The Affordable Care Act, commonly referred to as Obamacare, passed in 2010, and it attempted to overhaul the individual health insurance market. Obamacare standardized the insurance policies and created transparency and better customer protections, provided unlimited essential health benefits, and guaranteed insurance including people with pre-existing conditions. As of today, 56% of small businesses and over 99% of large businesses, which are defined as having 50 or more employees, offer some sort of health benefits for their workers. Now, in a 2019 survey done by the Kaiser Family Foundation, they found that 86% of people on an employer-based health insurance plan positively rated their plan and their coverage. Now, this high degree of satisfaction could be an issue for proposals such as Medicare for All by Senators Bernie Sanders and Elizabeth Warren, who want to replace the employer-based health insurance with a national health insurance plan that would be funded by tax revenue. And any risk in coverage from a healthcare system overhaul may not garner the support of the American public. So there are many different players in our healthcare system. There are the insurance companies, the large hospital networks, the pharmaceutical industry, the medical providers, the government, and the American people. And whether you are a Democrat or a Republican, there are going to be some very difficult decisions to be made regarding our healthcare, and none of them are going to be quick or easy. The upcoming election in 2020 will be interesting to see what direction the country is going to go in, and if any comprehensive healthcare reforms will be made. So guys, hopefully you learned something about the employer-based health insurance plans that cover over 50% of Americans. And if you have any questions regarding this topic, send me a message down below in the comment section, or on Instagram at ECA Moments. And if you're liking this video, hit that like button, click the bell so you get notifications when I posted a new video, and subscribe to the channel if you haven't already. And until next time, ciao.